As of my last update in September 2021, dengue fever is a mosquito-borne viral infection that affects millions of people worldwide. Dengue is caused by the dengue virus, which belongs to the Flaviviridae family and is primarily transmitted through the bites of infected female Aedes aegypti and Aedes albopictus mosquitoes. While most individuals recover after their first dengue infection, a second infection can lead to severe complications and potentially life-threatening conditions. In this response, we'll explore the complications of a second-time dengue infection, also known as dengue hemorrhagic fever, DHF, or dengue shock syndrome, DSS, in detail. Dengue hemorrhagic fever, DHF. DHF is a severe form of dengue infection that occurs after a person has been infected with a different serotype of the dengue virus than the one they were initially exposed to. The immune response to the second serotype can lead to an exaggerated reaction, resulting in DHF. This condition is characterized by bleeding tendencies and increased vascular permeability. Dengue shock syndrome, DSS. Dengue shock syndrome is an extreme form of DHF where the patient's blood pressure drops to dangerously low levels, leading to shock. The severe plasma leakage, together with other factors, causes a rapid decrease in blood volume, which can result in organ failure and even death. Immune enhancement. One of the critical factors contributing to the severity of a second dengue infection is the phenomenon called antibody-dependent enhancement, ADE. ADE occurs when non-neutralizing antibodies from the first dengue infection interact with a different serotype during the second infection. Instead of neutralizing the virus, these antibodies facilitate its entry into certain immune cells, leading to more severe infection outcomes. Increased viral load. A second dengue infection may lead to a higher viral load in the bloodstream compared to the first infection. This increased viral load can overwhelm the immune system and cause more extensive damage to various organs, leading to severe complications. Severe bleeding. Dengue hemorrhagic fever is characterized by bleeding tendencies due to the increased permeability of blood vessels and reduced platelet counts. This can lead to a range of bleeding manifestations, including petechiae, purpura, ecchymosis, and bleeding from mucosal surfaces. Severe bleeding can be life-threatening. Organ failure. As the disease progresses, severe dengue infection can cause organ failure. The liver, heart, and kidneys may be affected, leading to potentially life-threatening complications. Plasma leakage and shock. Plasma leakage is a hallmark of severe dengue infection. The blood vessels become more permeable, causing fluid to leak into the surrounding tissues and leading to hypovolemia, low blood volume. In extreme cases, this can result in shock, where the circulatory system fails to provide enough oxygen and nutrients to the body's vital organs. Respiratory distress. In severe cases, dengue infection can lead to respiratory distress syndrome, characterized by difficulty breathing, rapid breathing, and low oxygen levels. Respiratory distress is often associated with fluid accumulation in the lungs, a condition known as pleural effusion. Organ-specific complications. Dengue infection can lead to various organ-specific complications. For example, liver, hepatitis, hepatomegaly, enlarged liver, and abnormal liver function tests. Heart, myocarditis, inflammation of the heart muscle, leading to cardiac complications. Nervous system, encephalopathy, causing altered mental status, seizures, or coma. Gastrointestinal tract, severe gastrointestinal bleeding and other complications. Kidneys, acute kidney injury due to reduced blood flow and hypovolemia. Complications in pregnant women. Pregnant women infected with dengue are at increased risk of severe complications, including preterm labor, spontaneous abortion, and maternal mortality. Secondary bacterial infections. During the course of a severe dengue infection, patients may become more susceptible to secondary bacterial infections, which can further complicate the clinical picture and worsen outcomes. Long-term effects. In some cases, individuals who survive severe dengue infections may experience long-term effects on their health and well-being. These can include chronic fatigue, joint pain, and neurological issues. Management and prevention. Management of severe dengue infections involves vigilant monitoring of the patient's vital signs and fluid balance, along with supportive care. Patients may require intravenous fluid replacement, blood transfusions, and treatment for specific complications such as respiratory distress and organ failure. Timely medical intervention is crucial to reducing mortality rates associated with severe dengue. Prevention of dengue infection is essential to reduce the risk of severe complications. Measures include mosquito control, eliminate mosquito breeding sites, use mosquito nets, and apply mosquito repellents. Personal protection, wear protective clothing, such as long sleeves and pants, especially in dengue endemic areas. Community awareness, educate communities about dengue prevention and early recognition of symptoms. Vector control programs, implement mosquito control programs, including insecticide spraying, in high-risk areas. In conclusion, a second dengue infection can lead to severe complications, including dengue hemorrhagic fever and dengue shock syndrome. These complications are primarily a result of immune enhancement, increased viral load, and exaggerated immune responses. Severe dengue can result in bleeding tendencies, organ failure, shock, and other life-threatening conditions. Timely medical intervention, supportive care, and prevention strategies are essential to reduce the burden of severe dengue infections and their associated complications.